To find us on Facebook too, Eyewitness News Bakersfield Now. Well, since the beginning of the year, we've been talking about spinal health and chronic pain, and last week we showed you an innovative new tool that can help fight back pain. And today we have a neurosurgeon to talk to us about the types of pain and how you can manage it. Please welcome Dr. Anthony Varela. Doctor, first, please explain the difference between acute and chronic pain.
Well, acute pain is pain that's just like it sounds. It's acute pain. It's the pain that lasts several minutes to several hours, and it's usually after an event. So some sort of physical activity, the weekend warrior. This is the typical acute pain syndrome. It usually gets better with analgesics. An aspirin, some rest, usually takes care of the acute pain symptoms.
Right. But when it doesn't, then we have chronic pain.
When it doesn't, then we're dealing with a condition called chronic pain, which is a condition which a lot of people deal with. And this is pain which just doesn't go away. And it's unrelenting. It doesn't respond to any sort of medications. And sometimes it doesn't even respond to rest. So this is the pain that's usually caused by something that's wrong. For example, a pinched nerve.
Okay. I will get more on that in a second, but first, what are some back and neck pain myths?
Well, some of the myths are, herbal remedies. People think that you take a magic pill and your back pain will go away, and unfortunately, for most of the patients, that just doesn't work. If a disc is pushing on a nerve, then the only way to really deal with that is to remove the offending agent off of the nerve.
Right, so like I can't rub oregano root on my back and expect it to...
Not really, and if anyone is thinking about using any sorts of remedies, they really should be backed by medical science and by the literature. And unfortunately, for a lot of these things that we buy over the counter, that's just not the case.
Some of them don't even have FDA approval.
Correct.
I mean, some of these supplements you can just willy-nilly say they do anything, and the FDA has no bearing on that.
Right.
What treatments are physically effective?
Well, whenever someone has back pain, the first thing that I do in my practice is I do a full history and physical exam, try to find out what the problem is.
Okay.
Many of these patients have been to several doctors, they've gotten 2, 3 opinions, and they're just in pain, they want to feel better.
Yeah.
The first thing that I do is to try a course of physical therapy. That's the mainstay, because quite frankly, most things are not surgical. They can be treated with the proper conservative therapies. So we do things like physical therapy, chiropractic care, traction therapy, epidural injections. These are all things that can alleviate the pain.
And there have been advances in spinal procedures as well, correct?
Absolutely. When the when all of the other non-surgical things fail, for instance, if a patient's been to an epidural doctor and it's just not working, then those patients should see a spine specialist.
All right.
And when they do come to see the specialist, what we can offer is minimally invasive surgery. This is a new technique which has basically revolutionized the way we treat back pain.
So you're not, I've had a couple friends who've had their spines fused, who've had these sorts of things happen, and they have limited range of movement now, and it's a horrible surgery that knocks them out for almost a month.
Right.
So what is minimally invasive surgery? Is it really truly just like a little robot that goes inside your back?
What we've been able to do over the past 10 years or so is develop techniques that allow us to access the spine through tiny incisions. We're talking about a centimeter.
Really?
So we're able to basically do the procedure, remove the offending disc off of the nerve through a tiny, minuscule incision. In most cases, the patients go home the same day.
No way. That's
Absolutely.
incredible.
10 years ago, the patient would be in the hospital for 4 days, writhing in pain, on morphine. In 2015, we can treat a majority of these patients through a small incision, get them home, and in many cases, we can get them back to work the next day.
This is incredible.
Yeah, amazing.
Let's talk about the reason why you've come here with me today. You are actually going to be holding a seminar, no-cost educational seminar, no-cost MRI review.
Correct.
And for those with chronic conditions in Bakersfield, this is a great event. First of all, I'll just tell you about it. It's going to be held at the Bakersfield Marriott on the 5th of March at 7 p.m. But first, let's talk about why you decided to have this here. What has brought you to Bakersfield?
Well, we realized that there's a need in Bakersfield. There's a need for for spine care. And because of that, we have decided to expand our practice from the Los Angeles area up to Bakersfield to provide the service to the residents of Bakersfield, because we really need to get these patients better.
Yeah.
So we're holding a seminar on Thursday, March 5th at 7:30 at the Bakersfield Marriott. And I will look at the patients and look at some of the films and try to dispel some of the myths about back pain and treatment of back pain, and try to steer people in the right direction.
It's so important, folks. He was saying to me that he's got patients who come down from Bakersfield to LA. I know a lot of people I've personally talked to in the community as well have had to make that that trip. And unfortunately, the worst thing you want to do is drive a couple hours in the car when you're having back pain. Am I right?
Absolutely. I mean, that's probably one of the worst things you can do.
Right.
And I've had patients come to me in a van laying flat.
Oh my
because
goodness.
they've had so much back pain. And, they've laid flat for, 2.5 hours.
Yeah.
Yeah, so we've decided to expand our practice to Bakersfield so that we can really have a hands-on approach in the community.
Okay.
Yeah.
There's a phone number right now if you would like to RSVP to that spinal seminar, 805-449-0088. Before I let you go, I have to ask you a question.
Yes.
On Facebook, some of my girlfriends and I were chatting, and we want you to dispel a myth for us.
Yes.
Is it true that after you have an epidural for childbirth that you can have chronic back pain?
You can, but it's usually not due to the epidural.
Okay.
Because the epidurals that are utilized in childbirth are a little different than the epidurals that are utilized in spinal surgery.
Okay.
Although they have the same name, they're a little different.
Good to know.
In terms of where the actual agent is placed.
Perfect. And
Yeah.
that is why I bring on the experts. Am I right? Am I right? All right. Thank you so much,
Thank you
Dr.
so
Varela,
much.
for being with us this fine Sunday. I'm going to repeat the info right now. The event being held at the Bakersfield Marriott March 5th at 7 p.m. There's the number on your screen if you want to go. I seriously suggest you RSVP. So they don't have to turn anyone at the door, but it'll be a great opportunity to get a free checkup by a doctor.
Absolutely.
I cannot think of anything better. Thank you so much.
Thank you.